My first impression of Peoria was that it was a small town and that there wasn't that much to do. But once I got here, everyone was so warm, so friendly.
Driving through Peoria for my interview, I was really amazed and impressed.
It's a smaller city, but I think that sometimes it actually feels bigger than it really is.
Peoria to me is just a great place to live. It's really easy to get around. You don't have to fight traffic after a long day of being on call, and it's really affordable.
There are a lot of things I really love about Peoria.
As a family, we love to go out and go to orchards. We love to come to the Riverfront Museum. We love to go to the Children's Museum here. We love to go biking.
So I love how easy it is to get around. I love the convenience of the community. There's affordable housing.
I can truly say it's the best of both worlds. You have a lot of the big city amenities without the traffic, which is awesome.
We wanted an international airport and a Costco, and it had both of those.
The idea of being able to run to the airport, park for free, and be able to fly anywhere I want to fly, I really love that about this community.
Hi, my name is Julian Lin, Program Director, and here to tell you about our residency program. This is an aerial view of our medical campus. St. Francis is the primary site where residents spend 6 of their 7 years of training. Methodist is the secondary site where year 4 and 5 rotations occur. When on call, resident cover both hospital, which are separated by Interstate 74. The Illinois Neurological Institute and Children's Hospital of Illinois are part of OSF St. Francis healthcare system. St. Francis has over 600 beds serving nearly 2 million people in downstate Illinois. At least 63 beds are solely dedicated to neuroscience, with one of the largest neuro ICU in the nation. St. Francis is a level 1 trauma center, the only one outside of Chicago and state capital Springfield. The Children's Hospital of Illinois is a hospital within St. Francis, housing over 75 pediatric subspecialties with over 125 hospital beds. As part of the pediatric neurosurgery, we offer monthly craniofacial and spina bifida clinics, and we are affiliated with St. Jude and Easter Seals in providing special care to children with neurosurgical needs. The I&I Outpatient Center is located adjacent to St. Francis Hospital that sees over 50,000 ambulatory visits per year. We are very proud of our comprehensive stroke center, the second center in the United States to earn this distinction, preceded only by Stanford University. At I&I, we have cutting-edge technology, including intraoperative MRI, Gamma Knife, CyberKnife, Variant Trilogy system, 2 O-arms, and the newly acquired ROSA robotic system for placement of stereo EEGs and deep brain stimulators. Here are a few words from our Brain Tumor Center Director, Dr. Andrew Sung.
Illinois Neurological Institute, along with OSF St. Francis Medical Center, are introducing advanced technologies to give brain tumor patients better outcomes, removing brain cancer like no one else can.
So an intraoperative MRI is essentially an MRI that is linked to the operating room. What it allows us to do is to scan the patient almost in live time as we're operating. Essentially what that allows us to do is to find out how much we've taken out, how much we need to still take out, and it also allows us to avoid taking out critical areas of the brain that are necessary for function. The really breakthrough feature of this is identifying areas that we can't see, and that we can now see and navigate. Here at OSF St. Francis and the I&I, we've developed a system where we can really efficiently image the patient and accurately image the patient as well and perform our surgeries better. It's not as common in this setup. We've only have about 5 of these centers nationwide with the technology that we have here. The I&I Brain Tumor Center is unique and superior due to the collaboration among neurosurgical oncology, neuro-oncology, radiation oncology, ENT, and also all of our support staff and brain tumor navigators. That's not found commonly in most places. It's easier to navigate in our system. We are at a location that allows much more convenience. At the I&I Brain Tumor Center, we treat approximately 250 to 300 patients a year at either Gamma Knife or in our operating suites. In terms of who would be a good candidate for intraoperative MRI, a lot of those with primary brain tumors, and what I mean by primary are those tumors that grow in the brain as opposed to spread to the brain. Any tumors in areas where there's critical function very close by, the intraoperative MRI will help us find those areas, and it shows us on our screens where speech might reside, where vision resides, where strength resides, and we can try to avoid those areas because we can see them better. We can take more out and preserve those critical areas.
Illinois Neurological Institute, the region's only intraoperative MRI, removing brain cancer like no one else can. Learn more at ini.org/imri.
Dr. Maldonado is our newest faculty joining us from Cleveland Clinic, who along with Dr. Tracy makes up our functional and epilepsy program. Dr. Din, Fassett, and McCall are our main spine neurosurgeons, providing comprehensive care in spine, including deformity, pain, and oncology. Dr. Sung is the director of our brain tumor program, while Dr. Kloffenstein heads our cerebrovascular team and is also the head of our department. We are currently at full complement of 11 residents, admitting 2 and 1 resident every other year. For this 2020-2021 academic year, we will be recruiting and matching 1 resident. Our PGY1 resident or intern spent 3 months in general surgery, 6 months in neurosurgery, and 3 months in neuroscience, which include neuroradiology, neuropathology, and neurology. Second and third year experiences consist of monthly rotations in critical care, pediatrics, and night float. Typical night float week starts on Sunday night and ends on Friday morning. Calls are split between senior and junior calls. There are in general 4 senior taking backup calls on a weekly basis. The remaining resident takes primary call during the weekend and usually work every other weekend. Obviously, the night float resident do not take calls. 4th and 5th year residents are considered intermediate residents, and their rotations are very flexible. At least 6 months must be spent in endovascular and may extend to 12 months if the residents are interested in endovascular fellowship. The remaining time can be spent at Methodist outpatient clinic, elective, or research. PGY 6 residents are our chief residents responsible for the day-to-day function of our main service at St. Francis, especially in deciding resident participation and coverage of surgical cases and conferences presentations. Our PGY 7 resident can pursue an infolded spine fellowship to master the nuances of more technically challenging spine cases such as deformity and oncology. Another option could be focused practice in a particular area of interest, such as vascular or brain tumor, in which the PGY 7 resident function as a super chief resident or junior attending. This is an overview of our didactic schedule. We basically have conferences starting every day at 7 a.m. Friday grand rounds are rotated between neurology and neurosurgery. We have a 100% passing rate on the ABNS primary exam, typically taken for credit at PGY 4 year. I am very proud and happy to report that for the past 2 years, our PGY 2 residents have passed the written exam on the first try. Brain cutting sessions typically occur quarterly, taught by our excellent neuropathologist, Dr. Sarah Bach, who also gives an extensive board review on neuropathology every spring. We also have a dedicated anatomical skill lab. I will let one of our former graduates tell you about it.
The anatomical lab here at the Jump Simulation Center provides us with the opportunity to work on our surgical skills, actually identify anatomy that we rarely see in the operating room. It helps us mature as surgeons, I believe, and helps us become better and foremost safer in the operating room.
Our lab provides the surgical residents with an opportunity to spend time with the cadaveric specimen, to review intricate anatomy in a stress-free environment. The residents use our lab in order to carry out cadaveric dissections, as well as practice different surgical procedures. Our anatomical lab is set up with 5 stations. We have a proctor station and then 4 student stations. We have an operating microscope, which is commonly used by the neurosurgeons. We have 2 dissecting microscopes or tabletop microscopes, which can be used for smaller dissections.
Starting from basic forceps all the way to micro instruments that are highly specialized. So we have a full range of all the instruments that are used for spine or cranial surgery.
We have stainless steel dissection tables, as well as a surgical table, which is radiolucent. Therefore, we can use it for imaging. And we do have the 2 C-arms in the lab, which we can use with the surgical table in order to get images of the cadaveric specimens if we so desire.
So what's going on right now, it's a cadaveric head dissection. So it's a fresh specimen, that fresh latex injected specimen. All of them are injected, so we can identify the vessels, the arteries and the veins. We're dissecting the mastoid process. We're doing a transmastoid approach to the posterior cranial fossa. This is kind of a neat approach, rare pathology, so we don't do that a lot in residency, but we have a chance to do this in the lab, so we can identify anatomy that we don't regularly see in surgery that often.
Because we use fresh frozen cadaveric specimens in the lab instead of using embalmed specimens, the tissue is very lifelike and realistic. Therefore, when the surgical residents are practicing a certain procedure on the specimens, is comparable to performing an operation over at the hospital.
That's one use of the lab. The other use of the lab is through a small microscope that we have over there. We can do we have synthetic microvessels that the lab has provided us, and then we can use them to do microsuturing. So we can actually cut the microvessels and anastomose them with microsutures and microinstruments under the microscope.
Also in the anatomical lab, we have a Medtronic high-speed surgical drill. This drill is very compact in size, which makes it ideal for performing surgeries in a very confined anatomical space where there's very sensitive neural and vascular structures that they need to be cognizant of and aware of. To practice using the drill here in the lab first before going over to the OR and using it there is a huge benefit.
The lab is fantastic. It's ideal. It's very well equipped. Everybody's willing to help at all times. Communication is excellent. Basically, what I really love with the lab is I can get all the specimens I need. Then all the instruments are there for me. I can work in the lab, on a specific time that I choose to, and I schedule for as long as I want to. And then, at the end of the day, I don't even have to pick my mess up. Other people do that for me. I mean, this is fantastic. I don't know of any other lab that works this way.
Companies or corporations are able to rent out our facility at a very reasonable price. Our center is ideal for hosting a workshop type of event because we do have conference rooms in which didactic instruction can take place, and then afterwards the healthcare professionals can come here into the anatomical lab and carry out the dissection and procedural portion of the workshop. And then there's also in-light cameras that can record and stream live video to other rooms within the building. At Jump, we're here to provide you with excellent customer service, make sure that your objectives are met, and ensure that your event is a success.
We average approximately 2,600 cases every year as a department, and this is the breakdown of our cases. Our 2017 graduate logged in 1,583 cases and compares favorably with other programs nationally in these 5 areas. And here are the numbers for our 2018 graduate. We did not graduate a resident in 2019 as we transitioned from our previous 6-year to our current 7-year program. In 2020, we graduated our first 2 residents who completed the 7-year program, and here are their numbers. At this point in time, ACGME has not released the statistics for 2020 graduates. In closing, we are extremely proud of our residents and are grateful for their dedication and hard work.
Hi guys, my name is Jeff Kloffenstein. I'm the chairman of the department here, and you've had a chance to kind of see this video about the program. Hope you've enjoyed it. I just want to wrap things up by saying a few things. You know, the video has really done a good job of showing the program, some of the details, the clinical expertise we have here. I want to wrap up with two things that you really can't capture in a video. The first is the clinical volume here. You know, as residents who are coming into a training program, one of the biggest things to look for is clinical volume, and our resident to caseload balance is really phenomenal. And I can assure you that your training here surgically will be second to none. And the last thing I want to extend to you, and this perhaps is the most important thing, is something you absolutely cannot see in a video, cannot experience without having come here, which obviously in this era you can't do. And that is really the esprit de corps we have here, the relationship between the residents and the attendings, the residents to residents, attendings to attendings. It really is a family type atmosphere. It's very benign. We don't have a malignancy here where there's a lot of crushing of spirits and so forth. Everyone gets along well, and we enjoy our time together. And that's something where you're going to be spending 7 years at the next place you go in residency. And that esprit de corps is really important. I just want to share with you that that's something that's been built here over the course of a decade or so, and is a defining hallmark of this program. So again, I hope you enjoyed the video. If you have any questions, feel free to email. We look forward to meeting some of you guys, not so much in person, but via Zoom, and we'll talk to you soon.